So we were talking about structure of retina, right? We'll very briefly review it and then continue with few more important points. Already you have watched 2 videos about the structure of retina. And I know you must be remembering well. I told you about the basic structure of retina. One way to look at it is that there is a receptor, yes. Of course, after endothelium, after epithelium, pigment epithelium, yes, receptors, then bipolar cells, and then ganglion cells. Once you make this chain, right, then you will add high. You remember? Yes. And then you will add man, right? I didn't explain these 2 points. Let's do it rapidly. And that if this is the epithelium, which epithelium? Pigment epithelium, right? Pigment epithelium. Today we will go into detail of pigment epithelium, its structure and its function, right? And now in pigment epithelium, what are these special? What are these? Okay, first I will make the nuclei so that, and in these cells, of course, there are a lot of melanosomes as well. Not melanocytes, melanosomes, which are the melanin filled vacuoles here, which basically absorb the stray light, right? And what are these? Tight junctions, and these are melanosomes, and here again tight junctions, melanosome, and again tight junctions, right? So then what is there? RBG. What is that? Yes, receptors, photoreceptors. I will just draw basic structure again, and then we'll go to some points in detail, right? And we'll draw the receptors here. This is, yes, this is rod, and let's suppose this is also a rod, right? And here I can draw a cone, right? We can make 2 rods more also. Now I'm making a little fast. So outer segment, yes, inner segment, and nuclei, and yes, spherule, it's synaptic terminal. In the case of rods, this is spherule, and in case of cones, it is pedicle, right? And this is inner segment, and here is, right. So R, then B. B are which cells? Okay, I will make them all with the same color. So these are bipolar cells. Now here it is important, rather I must show that rods usually have more convergence. Rods have usually more convergence to the bipolar cell. For example, there may be one bipolar cell connecting to multiple rods, right? Okay, I will make this also here so that, yes, these are bipolar cells. And after that, what is there? RBG, ganglion cells, and from here what is this going? Nerve fiber. Is that right? Yes, please. What is your question?
Cones have one-to-one connection with the bipolar.
Yes, cones have one-to-one connection. We'll talk about that, of course, for sure. So you want me to keep it one, and we can make it like this. Now you are happy? Thank you. Okay, he's right that in the macula, especially in fovea centralis, one bipolar, one ganglion cell. This is a private line for the cone business. Rods are usually having a public life, multiple rods connected with one bipolar and then to ganglion cells. Is that right? And these aspects have some functional importance. We'll discuss it later. Now, RBG, then we come to high. Yes, horizontal cells, amacrine cells, interplexiform. So, what are these cells which are connecting here? Horizontal cells, right? And what are these cells connecting here? Amacrine cells. And what are these cells? interplexiform cells. Is that right? Then we come to MAM. Okay, I will make it black. These were the glial cells. M for Muller cell, as we discussed. Muller cells have their cell body here, and they have one process going to the outer area, right? And these processes, yes, connect with the inner segment, right? In the same way, inner segment, and in the same way they come over here and connect with the inner segment of rods and cones. So these are the outer ends of Muller cells. And this line, this wavy line which appears, basically these are zonula adherents. What is this line called? Outer limiting membrane. Is that right? And their peripheral processes, they go out as foot plates, and yes, this is inner limiting membrane, and here is the vitreous. On this side there is vitreous, on this side there is choroid, and from vitreous, as I told, some collagen and proteoglycans are also added over here. Is that right? So this was Muller cell, MAM1. Then A. This is what we didn't discuss in last lecture. A stands for astrocytes. A stands for astrocytes. Astrocytes are basically cells which are star-shaped cells, and they are mostly in the neuronal layer cells and in ganglion layer cells. They are also glial cells, and they are short processes, and these processes are supporting the neuronal structures as well as they are supporting the ganglion layer structure, and these processes also envelop the capillaries present over here. But capillaries which are present in the inner part, as I will discuss later, they are having some processes receiving capillary on outer side, processes from astrocyte, some processes coming from Muller cells. Then there is another type of cells. These are microglia. What are these? Microglia. And microglia are basically macrophages, right, which are present in central nervous system. And as you know, the neuronal, this layer of the retina is basically part of central nervous system. So microglia are also there, and microglia are actually spread in this is astrocyte throughout the retinal layers. So microglia may be here, or maybe here, or maybe here at multiple area, right? These are actually phagocytic cells. When retina is damaged, these cells increase in their number and they start phagocytosing the damage or the tissue which they want to remove from there after the injury. Am I clear? So now RBG stand for receptors. These cells, 3, and 3, 9 cells. There are more cells also, but these are the 9 most important cells which are contributing to the retinal neuronal layer. Because never forget epithelial layer which was derived from the outer layer of optic cup, and neuronal layer was derived from the inner layer of the optic cup, right? So these are the 9 cells. Any question up to this? So this is complete. Now there are few more important points. I will go to some important points in detail. For example, the function of pigment epithelium. Let's talk about retinal pigment epithelium. What are the important functions of this epithelium? It has many functions, and many very important functions. If those functions are disrupted, then even neuronal layer cannot be maintained well, right? And blindness can result. So what are the most important function of retinal pigment epithelium? One function is, if you start from this side, that this layer of epithelium act as a barrier between the choriocapillaries and the neuronal retina. Let me make choriocapillaries here. Listen, previously I told you this is posterior short ciliary arteries. They enter into choroid, and in the choroid they make short ciliary arteries, they make capillary loops, which are basically sinusoids. So I will draw sinusoids here. That let's suppose this is posterior short ciliary artery, and it will divide into multiple sinusoids. Is that right? They will divide into multiple sinusoids, and these sinusoids will of course eventually drain into what? Verticose veins. Is that right? They will eventually drain into verticose veins. Now, the point which I want to tell you, this is actually arteries come on the scleral side, divide into arterioles, then into smaller you can say vessels, and eventually choriocapillaries, which are not really capillaries, they are very wide caliber capillaries. That is why they are called sinusoids. These are the sinusoids, and these sinusoids are having endothelial cells which are fenestrated, and there are big interendothelial gaps also, right? If I draw one, let's suppose this is endothelial cell, then here is another endothelial cell. There is a gap in between those endothelial cells of these sinusoidal capillaries. Plus there are, you can say, holes present within its cytoplasm. So we say that choriocapillaries are highly porous capillaries, which are having fenestrations. It means apertures within the endothelial cell cytoplasm and also interendothelial gaps. So it means these capillaries endothelium is not working as blood retina barrier. So many substances can percolate out from here, right? But the real barrier is here. The real barrier is here. That from the outer aspect of retina, from the choriocapillary, blood which is moving there, the real barrier is put by, what is this? Retinal pigment epithelium and their tight junctions in between, and these epithelial lining determines that which substances should be allowed to go into outer retina and which should not be allowed to cross. Am I clear? Now, these actually choriocapillaries give to the nutrition to the outer part of retina, right? Especially outer 5 layers. Outer 5 layers, these are the inner layers. It means outer half. What are those 5 layers? As you know, one part of is epithelial cell, second is photoreceptor component of the rods and cone, then there is outer limiting membrane, then there is outer nuclear layer, and then there is outer, why they are becoming more? First is
Outer limiting membrane.
yes. Let's start with the first layer is epithelium, right? Second layer is photoreceptors. Okay, I missed it here. And third is outer, and fourth is this nuclei. Fourth is the outer nuclear, and fifth is outer plexiform. So actually, you can say from here, blood supply to the outer retina, outer 5 layers or outer half of the retina is indirectly, because itself blood does not enter here. Only substances diffuse in and diffuse out. So blood supply to the outer 5 layers of the retina is basically provided by the choriocapillaries. Am I clear? Then here I would love to mention that, as I mentioned previously, that retina has double blood supply, right? From outer side choriocapillaries are supplying, and from inner side central retinal artery. Again we'll discuss that later, but there is one blood-brain barrier on this side, another blood-brain barrier is on inner side. On outer side, blood-brain barrier is provided by retinal pigment epithelium, or inner side, let me explain. For example, this is a branch of central retinal artery. It has capillaries which are going in, okay, and coming back to vein. Here is the vein, and this is the central retinal artery. Now, these substances which come through, or blood which comes through the central retinal artery, it passes through these capillaries within the retinal inner layers and drain into central retinal vein. Now, here is also blood retinal barrier, but here the barrier is made by endothelial cells. Look here, these are endothelial cells, right? Number one, these endothelial cells are not fenestrated. Endothelial lining is not fenestrated. Secondly, these endothelial cells have tight junctions. They have tight junctions. So the tight junctions which were present here into retinal pigment epithelium, here the tight junctions are present in between endothelial cells. So in inner circulation or central retinal artery and vein related microcirculation, the blood retinal barrier is maintained mainly by endothelial cells and their arrangement. That here the endothelial cells are not fenestrated and interendothelial gaps are not there because those gaps are tightly stitched with, they are tightly held with tight junctions, right? So now what did we learn up to now? That retina has outer 5 layers, it has inner 5 layers. Outer 5 layer has own blood supply, that is choriocapillaries. Inner 5 layers have their own blood supply, that is central retinal artery and its system. Outer retinal blood supply has its own blood retina barrier, right, which is retinal pigment epithelium. Inner retinal vascular circulation has its own, what is this? Blood retinal barrier, and that is by the endothelial cells which are not fenestrated and endothelial cells without interendothelial gaps, as they are held together tightly by the tight junctions. Am I clear? So how many blood retinal barriers are there? 2. Is that right? Any question up to this? There's no. So we come back that this retinal pigment epithelium, function number 1 was, it was acting as, yes, what? Blood retinal barrier, right? Then second function is that light is coming from this side. Look, light is coming from outside and it hit the inner retina first, then light passes through the inner retina, right? It passes through multiple layers until light reaches the rod and cones and activate them. And extra light is absorbed by retinal pigment epithelium. This is very important, that extra light which is coming from here, which is not used by rod and cone, that should be absorbed by retinal pigment epithelium. Why? The reason being, let's suppose here the light is coming, right? Light has to pass through multiple layers. It has to pass through external limiting membrane, then through ganglion layer cell, then it has to pass through, yes, outer plexiform, inner plexiform layer, then inner nuclear layer and multiple layers. Eventually it will reach to the rod and cone, and when light will activate them and produce nerve impulses, right? And actually rod and cone are the cell which convert the optical image into neuronal activity, retinal neuronal activity. But extra light which is passing through, that should be absorbed by retinal pigment epithelium. Why? Because if this light is not absorbed, then this light will internally reflect here, there, here, and image quality will degrade. Image quality will degrade. So one of the very important function of retinal pigment epithelium is that it absorbs the extra light, right? So that there is not undue, what? Internal reflections of light within the eyeball, and image quality should not degrade. There should not be too much glare. Is that right? Now, here another example is of albinos. Albinos are the patients or persons who don't make melanin, and in albinos, retinal pigment epithelium does not have melanosomes. In albinos, when they enter into bright room, light enters through the retinal layer, it activates the rod and cone, but when it hit, what is this? Retinal pigment epithelium, it is not absorbed, and light has internal glare and internal reflections, and their optical image sensing quality degrades. And that is why albinos, even with the maximum optical correction, they can't have 20 by 20 vision. Is that right? Am I clear? So what was the second function? That was light absorption. Light absorption. Now the third function of it. Third function of retinal pigment epithelium. Now, it has one more function that is related with the functional aspect of rod and cone. Actually, it maintains the integrity and functionality of photosensitive part of rod and cone. How? You know, when light falls on the rods and cone, it bleaches the visual pigment. You know, visual pigment which is present in rod is rhodopsin, and in the cones it is iodopsin. When light falls on the inner this outer segment, and on the outer segment of rod and cone, when light falls over here, the visual pigments which are present over here, they undergo bleach reaction, and during that process they activate the nerve impulses. But those pigments and their derivatives are taken up by epithelial cell, and those are regenerated and recycled to be used by the outer segments. Is that right? You know, vitamin A is very important for this process, right? Vitamin A is retinol is the part of visual pigments. Is that right? And this epithelial cells, retinal pigment epithelial cell, do store vitamin A as well, and also they are able to convert all trans-retinal into 11-cis-retinal. That we will discuss in detail when we talk about functions of rods and cones and how they perceive the light and generate the current. But for a while, you just believe me that visual pigments which is present over here, visual pigment is a photosensitive chemical. When light falls on these light sensitive part of the rod and cone, visual pigment present over here, it bleaches, and during this process impulses are produced which go to the central nervous system. Is that right? But those bleached pigments are recycled by the help of retinal pigment epithelium, and they are recycled and regenerated to be used again. So this is one more function of retinal pigment epithelium. What is that function? Regeneration of bleached visual pigment. Visual pigment. It leads to regeneration of bleached. Then another important, not only here it is managing the function of the rod and cone, it also manages the structural aspects of rod and cone. Actually, rod and cone, here are the discs. Let me make one rod outer segment big. This is inner segment of the rod, and this is the outer segment of the rod. Now outer segment of course here is the nucleus of the rod, and here it is synaptic terminal. Now it is having a lot of disc, about 1000 disc, right? And these discs are floating into its distalmost part. But here there are membrane infolding. Originally when discs are made, they are made as a membrane infolding. Later on these membrane shelf detach and they are freely floating. Now this is the outer segment, and here it is inner segment. Inner segment here is having mitochondria, right, in this component, and more near to the nuclear side in this area it has endoplasmic reticulum, and this is making what? The endoplasmic reticulum is making proteins, right? So visual pigment is being synthesized here, opsins and other things. So what really happens? That, let me draw the functionally. This is outer segment, and this is inner segment. And inner segment, this part which is having mitochondria, it is called ellipsoid part. And this part which is concerned with protein synthesis, this is called myoid part. So this is a very brief structure of rod and cone. So what is really happening? Proteins are being synthesized here and then transported to outermost segment. Is that right? Here these visual pigment and proteins, they are added to the membranes membranes. They are embedded in the membranes. And then these membranes are loaded with visual pigment. If I make visual pigment black, so this is a part of these membranes, visual pigment. Or here it is rhodopsin. Is that right? Yes. Now, what really happens? As time passes by, more and more discs are coming. An older disc, they are eaten up by retinal pigment cell. And you may find here a phagosome in which a tip of the outermost part of the rod, that is photosensitive part of rod or cone, the tips are eaten by this epithelium. So it means they are helping in, what is this? Maintenance of rod and cones. The older components are phagocytosed by retinal pigment epithelial cell, and fresh components are being synthesized. Is that right? So it is not only playing, you can say, reactivating the visual pigment, or recycling the visual pigment, or regenerating the bleached visual pigment. It also is, what is this? Phagocytosing the tips of rods and cones, right? So that new components keep on making, and older components are taken by these cells and degenerated. Am I clear? So it means they are also concerned with the turnover of rod and cone, turnover of outer segments of rod and cone. The one more function. Retinal pigment epithelium is really very complex functionally. Right? In the beginning, many years back, decades back, doctors were just thinking it's just an epithelium which is absorbing the light. Then we came to know it's absorbed the light also, and it also acts as a barrier. Then we came to know it also recycles or regenerates the visual pigment. And we also saw under the microscope that these cells are having tips of the rods and cones, and they are catabolizing them so that new can be made. And now we know that this epithelium also produces growth factors. Growth factors, and these growth factors are released to choriocapillaries, and also these growth factors are released to the rod and cone layer. And these growth factors are very important for maintenance of the whole this structure. Why? Because growth factors which are produced by retinal pigment epithelium, number one, they act on the endothelial cells of the choriocapillaries and maintain their integrity and health and functional and structural function, right, aspects. Plus these growth factors also work on rod and cone and also maintain their structure and function. Am I clear? And in the end, don't forget that it also produces some immunosuppressive substances, right? So we can say retinal pigment epithelium has many important functions, and if these functions are disrupted, when retinal pigment epithelium is destroyed, right, then retina neuronal layer cannot be maintained well, and that eventually leads to blindness. Any question up to here? Yes.
So why does it produce immunosuppressive factors?
The reason being that it does not allow severe inflammation here, because if there is severe inflammation in reaction to any pathology, as you know, rod and cone outer segment and these epithelial cells, they are very loosely attached. So if inflammation is there, what will happen? Fluid will come and retinal detachment will occur. So in this way, they try to suppress inflammatory reactions here or microbiological and immunological reactions here, so that there is not too much drama of inflammation in this very important part and delicate part of our biological system. Is it clear? Okay. After this, now we go to the little detail of rod and cone and their differences. The differences between rod and cone. The next point. Now, here I will make one rod. Yes, this is its outer segment, as we know already, right? And here it is inner segment, and here it is nucleus. Now, here is a structure which is cone. Now, in the cone, actually, their disc don't detach from the membrane. In the cone, disc don't detach from the membrane, so they remain like this. Am I clear? Now, what are the differences between rod and cone? There are so many differences. Let's talk one by one. Number one, rods are more abundant. There are about 100 million rods and there are about 5 million cones. 5 to 7 million cones. Rods are more abundant. Number two, of course, rods, outer segment is rod shaped and cone, outer segment is cone shaped, conical. But this is not true because the cones which are present in macula, fovea centralis, they are rod shaped. They are roddy cones. Cones which are present in the fovea centralis, because fovea centralis is the part of the retina with maximum visual acuity, lot of cones are very tightly packed. You just imagine rods are like boys, men, and cones are like women. But the cones which are present in the fovea centralis, they are like smart models. They are very slim and smart and rod type, apparently. You are understanding what I am saying? That in the peripheral retina, rods are rod shaped. Rods are always rod shaped. But cones in the peripheral retina are conical. But cones which are present in fovea centralis are their inner segment is smart, this also component smart, so that too many cones can be put into fovea centralis to enhance the visual acuity. I will talk about that later. Why fovea centralis and macula, that is central vision, has sharpest acuity. Right? But let's come back. So generally speaking, rods are rod shaped, and generally speaking, cones in the peripheral area are conical and fat. They are like fat ladies. Right? But cones in the fovea centralis or macula are very smarty. Smart models. Why you're, oh my God, these boys are having pupillospermia. Wow, very bad. Okay. So this is about more difference. These are 100 million, these are 5 million, these are rod shaped, these are conical shaped. Yes, these are having rhodopsin as its visual pigment. What is there? Rhodopsin. Dopsin. I should write it. Sin. And this is iodopsin. Now visual pigment in all the rod is similar. Right? But visual pigment in the cones is different from the rod. That is why it is not called rhodopsin, it is called iodopsin. But actually visual pigment which is present in different cones, there are three types of visual pigment which is present in the cone. And these three, some visual pigment respond better to the blue light, some respond better to green light, and some respond better to red light. Actually, we can say visual pigments which are present in cone, right, which are present in red, blue and green, so-called green cones, actually those visual pigment have slightly different spectral sensitivity. The sensitivity to the wavelength spectrum, light wavelength spectrum is slightly different. Is that right? Now, go back. 100 million, 5 million, rod shape, cone shape, rhodopsin, iodopsin, all of them are same. Now another point. This is concerned with black and white vision. Rods are concerned with black and white vision. But cones are concerned with color vision. Let me explain what is really meant by this. Color vision and rod and cones. It will be better explained if I tell you, let's suppose here is the retina and what do you think? What is it? Optic disc, blood vessels. And let's suppose here is macula lutea and this point is fovea centralis. Right? Now, fovea centralis and area around it, it is called macula. Macula is concerned with the central vision functionally, and other part of retina is concerned with the peripheral vision. Now, important point is if I show cones by the red dot, then actually fovea centralis is very, very rich in cones. Highest density of, rather it is have only cone. So we can say fovea centralis and macula is extremely rich in cones. We can call it rod free area or cone only area. Cone only area, right? Opposite to that, the peripheral most part, I will show rod by the black dot. Peripheral most part of the, what is this? Retina, it is rod only area. What is this? Rod only area. And in between, in central area and most peripheral area, rest of the area has mixture. It has some cones and some rods. It has some cones and some rods. Is that clear? So we can say, if we start from the fovea centralis, we are sitting only on the cones. And if we start walking outside on the way, we'll see progressively cones concentration drop and rod concentration increase. And when you reach at the periphery, you find that is rods only. Am I clear? Due to this reason, the cones provide different visual aspect and rods provide different. Right? The visual aspects which are given by the cones, we also call it central vision. And visual aspects which are determined by the rods, we call it peripheral vision. Now, what is the real difference? There are so many things. Let me tell you the difference between macular vision and peripheral vision, or we can say central vision and peripheral vision, or vision by the cones and vision by the rods. Right? Let's discuss it now. As we discussed previously, that with one bipolar cell, let's suppose here is one bipolar cell. One bipolar cell may be connected with many rods. These are, I'm showing, rods. But in this area, maybe 2 or 3 cones may be connected with one bipolar. Right? But in the macula, especially in the fovea centralis, cones become very smarty. They become very smarty and they are connected one-on-one with the bipolar cells. Is it clear? Let's remove this component. We just remember to compare peripheral retina, central retina. Is that right? Or we can say rod connections and cone connections. Of course, in the end there is what? Ganglion cells. Now we can say every cone in fovea centralis has its private line going to the central nervous system. So one cone talking to one, hello, bipolar cell talking to one ganglion cell. So these are private lines going, very private and personal line. Of course they are models, they have their demands and their, okay. And these rods, many rods can manage one bipolar cell and be happy with it, right? So these are multiple rods connected with one bipolar. Now this thing has some functional differences. This anatomical arrangement produces some differences. Number one is, what do you think? Cones will be more sensitive to light or rods will be more sensitive to light? Who will tell? No. Again, cones will be more sensitive to light or rods? You think cones, why? 1 to 1. No. It's not good. Let me explain. Actually, rods are more sensitive. Now, apparently you think it should be the cone, but actually rods are more sensitive to light because rod can activate bipolar cell at very low light, at low illumination. Why? Let me explain. If there is very dim light, suppose, now, when very dim light, let's suppose illumination is 100%, illumination is 5%. We just think, here illumination is 100 unit, here illumination is 5 unit. I will make more simple example. We take two situations. You go, when you are walking at night outside the house, right? That is dim vision, dim light. right? For example, now in that case, suppose 5 is light is only 1 unit, okay, 1 unit, right? And when you enter into room from the dark area, or you're standing in a room and this is darkened room, light is suppose only 1 unit, and when you put the light on, switch on, light suddenly increases. Let's suppose it goes to 3 times more, 3 units. Is that right? Am I clear? Now imagine in very dim light, when 1 unit is there, when 1 unit fall on this, it cannot activate. Because very little illumination, it cannot activate 1 cone. And even if this cone is very little activated, it does not produce enough current to activate the bipolar cell. When light is very low, it may activate cone a very little because it produces what? Graded potential, but potential is so low that it cannot activate the bipolar cell. So do you think when room is darkened, such a low illumination failed to activate single cone, and single cone does not produce enough current to activate the bipolar cell? Am I clear? Yes. Now we come to the rod. Very little light, but it will activate it. Multiple rods are connected with, right? Here it was 1 unit falling, 1 unit falling, 1 unit falling. 1 unit is not enough to activate this chain. Here it is 1 unit falling, 1 unit, 1 unit, 1 unit, 1 unit, 1 unit. Many 1 unit produce very, very little currents which are added together and activate the system. Is that clear? Yes. Or not? So what happened? Rods have low sensitivity. Rods at low illumination level fire and give the signals. Why? Because multiple rods are connected with one bipolar. Multiple rods are connected with one bipolar. I will make the rods black so that this diagram become more clear. Multiple rods are connected with one bipolar. Every rod with very little current added together can activate the bipolar, and then current goes in dim light. But when there is very dim light, 1 cone cannot produce enough potential to activate the bipolar. So at very low illumination, cones fail but rod work. Is that clear? One of the reasons for this is that there are multiple rods connected to one bipolar. There is more convergence, and here it is private line, personal line. Just imagine that if telephone line is having public line with many people, it will be too much rush. But if it's private line, it is not active all the time, except when you are talking to your, right? Am I clear? So now I ask you a question. Cones are more sensitive to the light illumination, dim light, or rods are more sensitive? Rods. So rods are more sensitive photoreceptors. That is why at night or at low light, only rods are working. And that is why low light, when pupil dilate, peripheral part of retina become illuminated with dim light, and you are able to see with dilated pupil activate your rods. Right? But rods have one problem. They don't respond to different wavelengths in color vision. For example, if you are sleeping, right, with light off in your room, and suddenly a very pretty girl with very colorful dress enters in your room. Again, all of you are having sperm coming out of your eyes, right? Control. A very pretty girl with dress up properly, but colorful and very decent makeup. She enters in your room. If you open your eye and it is dark, of course it's romantic, but still control. If it's dark, do you think at this moment your rods will be working or cones? Rods will be working. I'm talking about rods, not rod. Then your rods will be working. Yes, seriously attend the lecture. Rods will be working in your eye actually. Right? Do you think your cones will work at that very moment if there is no light on? No. So you may feel that there is a lady or girl, or even you just see there's a human being depending upon how low light is. But can you tell what is the color of her dress? What kind of lipstick and makeup and other things she has done? No. Can you see the detail of her face? Can you recognize her, that beautiful girl is your girlfriend or sister or mother or what? In very dim light you cannot, if she doesn't talk. Because rods don't see the detail. Why they don't see the detail? Because even though they are activated at very low illumination, right? But the problem with the rod is that multiple rods are connected to one line. So either this rod is activated or that rod is activated, same message is going. So details cannot be deciphered or inferred. You understand it? But what you will do if that lady comes? You will put the light on or not? I hope she will put the light on. Right? And if she puts the light on, suddenly everything becomes colorful. You get it? You will see what is the color of her dress, what is the type of lipstick she has, what type of hair ribbon she has. You know, it reminds me of a few things. Okay, anyway. So, why? Because as soon as you put the light on, cones are activated. Because illumination level goes up. When cones are activated, cones have, number one, different cones are activated at different wavelength of light. So they can decipher the color. And secondly, as cones are very much concentrated in the fovea centralis, but they are having one-on-one private lines. So they are able to see the detail. You are understanding? But rods cannot see the detail. That is why, if you are holding the book, suppose, and studying at night, suddenly light goes. If power goes, you may still feel, you can look at the book, but you cannot read because details are missing. Is that right? But as soon as you put the light on, fine details can be seen. What happens? Cones become active. Is that right? So cones are more, rods are more sensitive, so they work in dim light. We call it scotopic vision or night vision. And remember, rod pigment depends a lot on vitamin A. And if someone has chronic vitamin A deficiency, rhodopsin's level cannot be maintained well, and rods don't work well. Such person has problem to see the objects in dim light. We call this night blindness. What we call it? Night blindness. Is that right? So rods are more sensitive. This is an advantage. Actually, I feel rod is a very primitive system. It's better for the night when we were in jungle life. There are like night animals. We cannot see the detail much, we cannot see the colors much, but we can still see even at low light. But as animals evolved, I think cone system as a modern system came. It was able to differentiate the colors and it was able to see the details. But it has one disadvantage, it needs more illumination. So that is why if at night you are standing along the road, you may see car is passing by or truck is passing by. But if light is very dim, you cannot tell what is the color of the car. Or can you tell? But if daytime, if cars and trucks are passing by, not only you see their detailed structure, you can also see their colors. Am I clear? Let's come back. Of course, cones are conical, fat, rods are smart. But cones in the macula lutea or fovea centralis are very super smart, super models. Is that right? Cones are only 5 to 7 million. It varies from person to person. And rods are about 100 million. You're millionaire as far as rods and cones are concerned. Is that right? Rods are more in the periphery and they are absent in the center. Cones are maximum in the center and they are absent in peripheral most part of the retina. Rods are multiple rods connected with one bipolar and one ganglion cell line. Cones in the fovea centralis especially, cones are on one arrangement with bipolar and ganglion cells. Is that right? Now, I will specially talk about that in the macular area, this central retina, not only it has color vision, it also has more visual acuity. What is visual acuity? Ability to see the structures in detail. This is a function of cones, not rod. Because when you put the light off, you cannot see the details. You may see the shades, but cannot see the detail. You put the light on, cones become active and you are able to see the detail, structural detail or color detail, both structural detail and color detail of the objects. Is that right? If someone asked you that what is the point of maximum acuity, sharpest acuity, that is fovea centralis. But why? One reason is that, okay, macula, first I make the statement, macula has sharpest visual acuity or highest visual acuity. Now macula has, especially fovea centralis, the center of the macula, right? This point. Sharpest visual acuity. What are the reasons? Of course, some reasons are very simple. You can say, number one, that a lot of cones tightly packed, and only cones and tightly packed cones as cones are. This is one reason. Second reason, one reason was cones are smarty, as I explained, and a lot of cones are very tightly packed, so a lot of better detail can be taken up by those cones and sent to the central nervous system. Is that right? Secondly, another thing. Actually, in the fovea centralis, inner layer of the retina are displaced. Why? Let me explain it. If here is your sclera, right? Here is your choroid, and here is your pigment epithelium, right? Now, here where there is fovea, right, what happens? It is only cone area, right? Actually, bipolar cells and other cell layer, they are like that. Cones have very long processes, and here is their bipolar cells. You get it? And here are their, suppose, ganglion cells. So actually here retina classical 10 layers are not present. Classical 10 layers are not present. Inner 5 layers are displaced, displaced outward. Why? So that light can directly hit the cones. That is the only point in the retina where inner layer means inner layer of these layers of, what is this? They are pulled aside, so light can directly fall on the cone. So what are the layers here? Here's the pigment epithelium, and first you can say up to the outer plexiform layer is there, but the ganglion nerve fiber layer is on the side, ganglion cell layer is on the side, bipolar cell and related all structures are pushed on the side. So one reason why visual acuity is so much, because when light is going directly to the cones, it is not passing through the inner layers of retina, so light scatter is less, so details are better appreciated here. Am I clear? So one more reason is why this is very with sharpest acuity or highest acuity. One reason, lot of cones. Two reason, cones one on one line with bipolar and ganglion, personal lines. So little area taking more signals. Third, that innermost layer of the retina are displaced away from the fovea centralis, so light can directly hit the photoreceptors, cones. Then there are other reasons. Even retinal inner blood supply is not present here. So this macula is taking its blood supply only from chorioretina, mainly from chorioretina. But from central retinal artery, the blood supply is not coming to macula. Because if vascular system is added on the top of it, that will also scatter the light and reduce the visual acuity. So if someone asks you, central retina, macula, having at its center fovea centralis, that is the point of sharpest acuity. Why it has sharpest acuity? Number one reason, the only cones. Number two, lot of cones. Number three, cones there have one-on-one arrangement, personal lines with bipolar and ganglion cell. And then retina layers are displaced on the side. And there is no blood supply on inner aspect. They only drive, this is the part of retina we drive blood supply only from choriocapillaries. Right? Other part, look, here the retinal vessels, they are also giving blood supply here. But here, up to here they will come, but not in this area. Am I clear? Any question up to this? Okay, so this was about macular vision. Now we come to another concept that we have learned about this function. We have also talked about in detail rod and cone structural detail, right? We didn't talk about how the electrotonic currents are produced. That we'll talk in some other lectures, right? Then we have also talked about that macula lutea and fovea centralis and why it has sharpest acuity, right? And what are the differences in rod and cone. Now we come to another point. Something special about the ganglion cells. Where are these ganglion cells? These are here, right? These are ganglion cells. As I told you in previous lectures, the ganglion cells are the only cells in retina which are having sodium gated, voltage gated sodium channels, so they are able to produce the action potentials. All other cells only produce graded potentials. Is that right? And they can send action potential to the central nervous system. Previously, it was thought ganglion cells are just picking the information from here and taking to the central nervous system. But now we know more things. Ganglion cells not only take up the information through the bipolar cell and transfer to the central nervous system, they also have two more important functions. Number one, some of the ganglion cells, they can sense the movement of the object. For example, optical image, when it is passing through, previously it was thought only rod and cone can make the image and sense the image. That is true, only rod and cone can make the image. But ganglion cell, when image is slipping on the retina, when subject is moving, the image optical image will slip on the retina. Some of the ganglion cells can sense that. So they inform the central nervous system about the movement, direction of movement. And one of the very latest information about the ganglion cell is some of the ganglion, not all, some of the ganglion cells, they are having also visual pigment. They also respond to the light, but they don't make the image. They respond to illumination, and those ganglion cells send special signal. Those ganglion cells which can sense the illumination of the light, they send the information to the hypothalamus, to the suprachiasmatic nucleus, to control the circadian rhythm, day and night rhythm. They can inform the central nervous system about day and night. Is that clear? So a simple doctor will think ganglion cells are just taking the information from the bipolar cell and passing to the central nervous system. But now we know two more things. Number one, some of the ganglion cells are sensitive to the optical image when it is moving. But more important than that, some of the ganglion cells also have photopigment or illumination. These ganglion cells start sending signals. The special ganglion cells start sending signal to the hypothalamus. There is retinohypothalamic pathway to the suprachiasmatic nucleus, and that nucleus, when receiving information from these, determines its daytime or night time and controls the circadian rhythm, your sleep and wake cycle, cortisol levels in the blood with circadian rhythms, and many other activities. Am I clear? Okay. Now we move further. This is nerve fiber layer. Remember, these nerve fibers which are present in the retina, right, they are not myelinated. Thank God they are not myelinated, because myelin is very refractile. And if these fibers are myelinated, right, even though they will conduct faster, but they will, because myelin is very refractile to the light, that will lead to degradation of the image. Is that right? But as soon as these fibers of the ganglion cell enter into optic nerve, immediately they become heavily myelinated by oligodendrocytes. Right? That is why diseases which destroy the oligodendrocyte or central demyelination, like multiple sclerosis, can damage the optic nerve. Is that right? Yes. Am I clear? Yes. Right? So after this, we come to one more area that we have talked about, this pigment epithelium. We know about rod and cones, we know about bipolar, and then ganglion cells, and then nerve fiber. Now I want to specially focus the nerve fibers from the ganglion cells, right? The axons, what are their final destinations in central nervous system, right? Let's come to that. From the retina, the fibers, where they go in the central nervous system. Let me make the midbrain here. Pons, medulla, midbrain. What is the superior colliculus, inferior colliculus, right? Here is pretectum nucleus, pretectal nucleus under the superior colliculus, and of course here is third nerve nucleus, and there is Edinger-Westphal nucleus, you know, things like that. Okay, but here at the top there must be, what is this structure? Thalamus, and let's suppose put here is lateral geniculate body. Lateral, okay, let me make it again. This is lateral geniculate body, right? And here is of course your hypothalamus, anterior and posterior pituitary. Is that right? And here is, I will put your beautiful eye. And there is the other eye there, and this is optic. And what is this? Chiasma. Okay, let me make this with different color so it stands out. These are the optic. This is other eyeball. Of course, you remember there are two eyeball. Okay, so here is hypothalamus, and this is what? Optic. This is optic nerve, optic chiasma, and this is optic tract. And this optic tract mainly end up into lateral geniculate body. Okay, lateral geniculate body. Now, and of course this will also end up on the other side, on the lateral geniculate body. Okay, now, and here what is this structure? This is hypothalamus, this is anterior pituitary, posterior pituitary, and mammillary body. Am I clear to this structure? Any question? Anyone who is confused about this diagram? It's clear? Okay. Okay, I will remove this too, so it becomes clear to you. Now, this is hypothalamus, and from lateral geniculate body, from here this is going optic radiation. This pathway is clear? Yes. And this is the, let's suppose, retina, and these are the fibers coming. Is that right? Optic nerve. Same here. Any question? It's clear to you? Now, what is the destination of fibers from the ganglion cells? From here. First, the classical pathway, the pathway which makes the visual image, the conscious perception of the optical images, right? That pathway, I will make it, okay, with which color? Okay. I will make it with the green pathway, okay. This green pathway start from here, from rod and cone, bipolar cell and ganglion cells, and this will go to the central nervous system. As you know, some fibers will cross over here, right? First optic nerve, then optic chiasma, then optic tract. They finish at lateral geniculate body. Is that right? Ganglion cells axon started from here and reach up to lateral geniculate body. From here, next fiber start and went to the visual cortex. Where is the calcarine fissure? At the occipital lobe. Is that right? I will not go into detail of visual pathway. Right now I'm just trying to tell that these fibers from ganglion cells, where they end up into central nervous system. Now this information that ganglion cells central axons through the optic nerve and optic chiasma and optic tract, they terminate at lateral geniculate body. Almost all doctor knows that. All good doctors know that, this pathway. And then from here, fibers are eventually projected to the visual cortex. There you have the conscious perception of image, optical image. Am I clear? But there are other pathways also. Let me make the other pathway with the green. That some of the fibers from here, they take information, they cross also. They take information, and before reaching to the lateral geniculate body, they separate. And these fibers come to the superior colliculus and pretectal nucleus. It means these fibers did not go to lateral geniculate body. These blue fibers did not participate into conscious formation of image. They took degree of illumination of light and gave this information to the midbrain. They did not pass through lateral geniculate body. Before the lateral geniculate body, through the superior brachium, these fibers came to the midbrain and they ended up into superior colliculus and pretectal nucleus, and they are connected with the Edinger-Westphal nucleus. Let's suppose this is Edinger-Westphal nucleus, and through this parasympathetic fiber go, and they will control parasympathetic fibers going to the ciliary ganglion, and post ganglionic fibers eventually control the ciliaris muscle and sphincter pupillae. So it means these ganglion fibers are giving information at subconscious level to the midbrain to activate the motor pathway for light reflex and accommodation reflex. Is that clear? For light reflex and also contribute to the accommodation reflex. Right? Then one more pathway I will tell. Green pathways are visual image making pathway. This was for accommodation reflex and people. Then some of the ganglion cells from here, they take the information and they go directly to hypothalamus, to the suprachiasmatic nucleus, the hypothalamus. This is your biological clock. This is able to measure day and night by the total stimulation. Daytime is different in total stimulation to this ganglion, at night is different, or sleep time is different. And suprachiasmatic nucleus along with hypothalamus, along with pineal gland, which is present over here, right, which releases melanin, it controls the circadian rhythm. So what did I tell you? I was talking about the central destinations of retinal pathway, which was actually the only output fiber from the retinal pathway were the axons from ganglion cells. So most of the fibers go to the lateral geniculate body, and eventually they activate the pathway which taking information to the signals to the visual cortex for the conscious perception of image. Some fibers from here, this blue pathway, go to the, of course they also go bilaterally, right? These fibers, because in the chiasma there is crossover, these blue fibers, they reach to the midbrain, right? And they control through the superior colliculus and pretectal nucleus, and eventually information going to the Dinger-Westphal nucleus. They control accommodation reflex and night reflex, especially pupillary reflexes and ciliarus muscle reflexes. Then next is that some fibers, some of the ganglion cells, I told you ganglion cells can also have photoreceptors or photosensitive pigment or visual pigment, and with degree of illumination they are firing, and these are giving information to hypothalamus, to the suprachiasmatic nucleus, and that determines the circadian rhythm. Is that right? One thing which is more important in the end, and that is when I talked about the retinal artery, that I told you previously, central retinal artery enter through the optic nerve and eventually enter here and gives deviance. You remember that I told you that yes, this was optic disc and this was your macula, and retinal artery, this is upper devian, lower devian, and it has nasal, upper nasal, lower nasal, and upper temporal and lower temporal devians. Here again I will stress the arc in such a way that they spare the macula, because macula only gets supply from choriocapillaries, does not get the blood supply from the retinal artery and its branches. Secondly, about the retinal artery, a very important thing, that it is end artery and its branches are also end artery. End artery mean that, let's suppose if this part of retinal artery is blocked by thrombus or due to any reason, dependent retina, in the respect of the dependent quadrant of retina, will not be able to get any blood supply from other collateral circulation. There is no collateral from there. So we say retinal artery itself is an end artery and its branches are also end arteries. Why we call them end arteries? Because when one branch or the artery itself is blocked, there is severe damage to the vein, because there is no collateral circulation supporting the blocked vessels territory. Any question you have up to this? Yes.
So what is the role of horizontal and hemacrine cells?
Okay, very important thing. He's saying what is the role of horizontal and hemacrine cells. Let's go back. They are basically mainly, predominantly inhibitory cells. Is that right? Now, this was, let's suppose, your epithelium. I'm making a very simple diagram. These are, let's suppose, your rods and cones, right? Rods and cones. And I'm making a very simple diagram. And here are your bipolar cells, right? Now, what are the function of horizontal cells? As I told you, they are inhibitory. They are connecting laterally. This is the hemacrine network. They are inhibitory GABAergic fibers. Now, what they are doing? Let's suppose light falls on these three image. Light is coming to this. Now, as all photoreceptors are connected with each other, bipolars are connected. If signals are going from here and here, it is possible signal inappropriately spread laterally. So these cells inhibit the lateral spread of currents, so that you should be able to make image properly. Am I right? Yes. Is it clear? So basically they are inhibitor. Secondly, they enhance. For example, if there are strong signals going from here, they inhibit the surrounding, so they become lateral inhibition, they become more suppressed. So this image forming mechanism stands out and enhances the contrast in visual analysis. Am I clear? In the same way, hemacrine cells they have many functions, but they are also inhibitory, and they don't allow the inappropriate spread of the electrical current within the retinal neural network. Any more questions? What are the importance of interplexiform? Okay, now you are putting a very special thing. Actually, interplexiform from outer plex outer plexus, they are giving current in reverse direction to the inner plexus. Now actually we know, for average doctor, optic nerve has only fibers which are going to the central nervous system, from retina to central nervous system. Recently they have discovered there are some fibers which are coming from the central nervous system to the retina. This is called centrifugal is going from retina to the central nervous system. Centripetal current flow. Previously it was believed that optic nerve has only fibers which are going from the retina to the central nervous system. But now recently they discover that from central nervous system fibers are coming to the retina also. Right? Don't overload your system anyway. And these very few fibers, they come and connect with the interplexiform. And so interplexiform is part of the centripetal flow. And those signals which are coming from here, they are modulating the sensitivity of different part of retina towards light. Am I clear? Any more question? Any more question? Class dismissed.